begins in more amount. So thus there will be an imbalance in the ratio of estrogen and androgens that will lead to gynecomastia. Clinical manifestation or sign and symptoms we can say. Gynecomastia usually manifests as palpable discrete button of tissue radiating from beneath the nipple and areola. Gynecomastia feels gritty when the breast is pinched between the thumb and forefinger. Fatty tissue, unlike gynecomastia, will not cause resistance until the nipple is reached. Next is examination finding. What are the examinations that we do for finding that a person is having gynecomastia kind of condition or not? First point, the examination is performed by having the patient lie on his back with his hand behind his head. As we can see in the picture also, we will say the patient to lie in supine position and we will say him to keep his hand behind his head. Then the examiner places his or her thumb and forefinger on each side of the breast and slowly begins them together. Then what will happen? Examiner will place their hand in the breast and bring them closer together slowly, so that we can see that there is exactly the increase in size of the breast or not. Second point, gynecomastia is appreciated as a concentric rubbery to film disc of tissue, often mobile, located directly beneath the areolar area. Pseudogynecomastia presents no discrete mass. Other masses due to disorders such as cancer tend to be eccentric positioned. Evaluation. Now, what are the diagnostic criteria or investigations that contribute to gynecomastia? So, first one is history. In history, what we will see? Age. Why age we will see? Because puberty hits 25% of the cases, and according to physiological, age is also a factor that contributes to gynecomastia. Then duration of gynecomastia, that means a person from which time he is suffering from the condition known as gynecomastia. So we will see the duration, whether there is pain or not. Also we will see the use of drug, because we have seen in the causes that drug contribute about 25%, or if there is any adverse reaction of any drug or patient is consuming alcohol, we will see all that histories. We can also see symptoms of hypogonadism or systemic heart disease. Next one is physical examination. Physical examination, we know that physical examination means head-to-toe examination. So in this, there is abnormality of breast, so we will examine the breast. So what we will see, pinch breast tissue between thumb and forefinger, distinguish from fat. Measure glandular tissue diameter, look for galactorrhea. Then testicular palpation, and we will see for also secondary sex characteristics. Baseline investigation. What are the investigations that we do after our history or physical examination is not that valid? So we will go for serum testosterone, serum estradiol, LH and FSH, that is luteinizing hormone and follicle stimulating hormone, prolactin, SHBH, HCG, human chorionic gonadotrophin, and last one is liver function test. Management. So first management we will see is medical management. The underlying disease condition should be corrected if possible, and offending drugs should be discontinued. First we will see that if there is any underlying disease condition, that means if gynecomastia is occurring due to secondary disease condition or it is secondary to any disease condition, so we should first treat the disease condition, then we should move further. And also we should check if patient is consuming any kind of drug or alcohol. So first it should be discontinued. Then second, ER antagonist tamoxifen or viloxafen are effective in treating pubertal and adult gynecomastia and preventing gynecomastia induced by androgen deprivation therapy. These are the medicines that should be given. Other drugs used such as clomiphene, danazol, testosterone. If there is any hormonal imbalance, then we can use this kind of drugs. Medical therapy is ineffective for chronic fibrous gynecomastia. The point which should be remembered is, if the gynecomastia is chronic, then medical therapy will not be useful for it. It will be ineffective. We can only give medical therapy if the gynecomastia is acute or it is in very less severe form or in moderate form, we can say. Surgical management. With long-standing gynecomastia more than 1 year, that is chronic condition where medical management is not effective, then we are going to do surgical management. So if gynecomastia is more than 1 year, surgical reduction mammoplasty, that is removal of breast tissue with or without periareolar adipose tissue, is necessary if breast enlargement is severe, painful, socially embarrassing or disfiguring. Surgery will be done only if breast size is increased up to that much that it is visibly. So we can go for surgery. Radiation therapy. Low dosage external beam radiation therapy is effective but less effective than tamoxifen for prevention of gynecomastia due to anti-androgen monotherapy for prostate cancer. We will do radiation therapy because it is the benign enlargement of male breast, that is the radiation therapy is carried out. Thank you for attending my presentation. I hope you all enjoyed today's topic 2. We will begin with new topic tomorrow. I hope you all learned something new today. Stay safe, stay at home. Thank you.